My name's Professor Nora Colton, and I'm the director at the Global Business School for Health. I want to welcome all of you to the Global Business School for Health, and particularly I want to welcome you to this course. This is a short course on global health systems. The course will be delivered by myself and Mark Brunell from KPMG, who's also a visiting professor at the Global Business School for Health. The reason we're asking all of you who are joining us in September to take this primer, as it were, this short course, is because it's really important as part of your journey in the Global Business School for Health, is to understand the school, to understand its role and its kind of vision in that kind of global health management space. So first of all, what is a health system? Well, health systems are lots of things. Most of us, when we think about a health system, we think about it at the macro level. We think about what governments do in the kind of public health space. But what you're going to learn as you take this course and move through the material, which will be a combination of videos, some readings, some short exercises and quizzes to really enhance your understanding and knowledge of health systems, is that health systems are much more than just macro policy. But macro policy is really important to health systems. It really sets the stage, as you'll see. And what we do at the Global Business School of Health is we try to really think about these topics in a manner to really help address many of the kind of big challenges that we face today. And in health and healthcare, we face a number of challenges. And those challenges come from lots of different avenues. One, of course, is that in many countries around the world, populations are aging. Some are aging at a faster rate than others, but we see in general that across the globe, we will have a much older humanity in which to deal with. And along with that comes the fact that people are going to live longer as well. And much of that we can accredit to science and modern medicine and the advances that we've made. But many of those people will live longer, but they might not necessarily have that many extra quality life years. They'll be living with other kinds of diseases and have comorbidities that'll impact their health. So they'll need long-term care and health treatment throughout those final years of their life. And we want to make sure that those can be fulfilling and rewarding and that they can access good health and health care during that critical period. The other thing is that we see that there are lots of diseases that are non-communicable. They're not necessarily coming from health or viruses, but they're coming from lifestyle. And many of those are impacting us more and more. Things like diabetes and heart attacks, and these have to be addressed as well. So when you put all this together, and then of course we do have communicable diseases as well. As we know, there's been a pandemic recently. All of these things, when they converge, put a lot of stress and strain on health systems and the ability to deliver. So when we think about health systems, we need to think about them in really context in terms of that macro environment. But then we have to think about them also in terms of organizations. What happens inside organizations? We can think of a hospital, for example, as a health system in itself. It's got patients, it's got core service teams, and then it's got the organization that sits in this wider environment. And all of these are part of that health system and that kind of macro as well as micro health system. So one of the things that you'll learn about then is how these kinds of systems work in different countries. And that kind of comparative approach is going to be very important to your education, not just in terms of the short course, but as you go through the Global Business School of Health, regardless what program you do. Because we really embrace this idea of what we call health management. So often when you think about health systems and how we've approached them historically and learned about how we analyze and study them, there's really been two bodies of literature that are addressed. One is really around health science, or sometimes called health service research. And that research looks more about pathways and uses data and looks at costs are often very important. So looking at how can we give more people access as well as reduce costs through how we administer healthcare. Then there's another second school of thought that we at the Global Business School of Health also very much embrace and believe actually that these two schools of thought and approaches to looking at health management are integral. And that is the more managerial or management practice approach. And this is often found in business schools, where you learn about how to think about power, politics, leadership, building teams, really what I'd call organizational culture. And that's really going to be important and integral to thinking about health systems, but also everything that you learn in the Global Business School of Health, regardless which program you're on. So these two really converge very much in terms of our thinking, our approach, and that really what I would call the intersection between business and business practices and health care. And that's what makes the space that we occupy so important and so unique. So in this short course, you're going to have the opportunity to get some general knowledge about health systems, the various components of health systems. We'll talk about the WHO and their building block framework. We'll look at that, the various aspects of that. We'll also then look more closely at a number of countries to see what are the best practices and things that we can take away from different health systems as we think more and more about what a health system looks like. And there's also that kind of partnership side. So one of the things that'll be very important in your education at the Global Business School of Health will be able to think about private, public partnerships, who does what, all the various stakeholders, patients. We talk a lot today about patient-centered care. What does that really mean? How do we measure it? How do we know when that's successful? And then we'll talk a lot about professionals in health organizations. There's a lot of tension often around who are the managers, who are the leaders, who are the clinicians, and what are the roles of those clinicians? How do professional bodies fit into that? How do they complement and impact? So we'll also be borrowing a lot from social sciences and thinking about how those relationships in terms of sociology, a little bit of anthropology, all of that comes together and converging in the Global Business School of Health. Because as an interdisciplinary group of academics, we're able then to pull lots of different ideas and see how we can kind of cross those ideas over into other areas to make our understanding of health systems more comprehensible, but also to find best practices and ways in which we can go forward. And then lastly, why is this so important? This work is so important because, as I mentioned at the onset, we live in a period where the strain on health systems is more and more. We need to give more people access, but we also need to make sure that it's high quality health care that they're getting. Another important aspect of this is the social and economic determinants of health. We hear more and more about this, and it's more than just climate change. It's the environment that people live in, the kind of opportunities they have. This will be something that we will also be exploring. And so I'm really looking forward to having you as a part of the Global Business School for Health. I think you'll enjoy this course. I'm looking forward to having Mark Burnell as part of it and part of your learning experience, and I hope you enjoy working through this material. Thank you. Where's the problem in health systems? Well, of course, there are lots of challenges, but we often have a tendency to think that only low-income countries have challenges or issues in terms of health and healthcare. But this is not necessarily true. We see that actually a lot of high-income countries spend much more in terms of costs of healthcare and healthcare delivery, and don't necessarily always get the same value. They tend to be inefficient. They have bottlenecks. The pathways to care are not always clearly defined. So it creates lots of different problems. So we can't just look at how much a country spends on healthcare and assume that that makes a well and healthy population. The other thing that we see that is a particular challenge today, and that is around social inequality. Nothing has brought that more into focus than the recent pandemic with COVID-19, where we saw in some very developed countries the impact that COVID had, particularly on different pockets of individuals within societies, many of them who were on lower incomes, even though they were in a high-income country, were not receiving the care, the kind of social and economic factors that are associated with well-being, such as education, quality of health care, and even their living environment, their housing. All of these things impacted the way they were able to cope during the pandemic and its impact on their communities. So this is something that we need to recognize. So when we talk about health systems, it's not just looking towards a few countries with high incomes or high spends on healthcare. We need to look across. There's lots to be learned from lots of different countries. And health and healthcare are not solely determined by a country's GDP. There's a growing recognition today that in health systems, we need to look to governments to really provide the overall guidance and support for really creating efficiencies and recognizing what needs to be done to create pathways that will create better, more resilient, and strengthen our capacities in terms of health systems. But much of that will really lie not with treatment, therapeutics, where much of the focus historically has been on, and not even with hospitals necessarily. What we're seeing is more health care delivered in the community, and that will be the model that many countries will take going forward. So we need to reshape our focus. We need to move away from just thinking about treatment. And even the term healthcare now is becoming challenged. We're thinking much more about health rather than health care. And the reason that's important is that rather than focusing our attention on how we're going to treat people who are ill, we need to focus our attention on how can we work with our population to prevent them from becoming ill. How can we create better diagnostics, better prevention, work with our populations to learn more about how they manage healthy lifestyles to really have healthy and long lives that don't include lots of therapeutics, particularly towards the end of their life. So this is really going to be the challenge of the 21st century, is how do we transition from a system that's very focused on hospitals and on the treatment of illness to a system that's much more embedded into communities, community hubs, and looks and really focuses on prevention and diagnostics, while also trying to treat those who are ill. And this is not an easy task, and I think really this is the challenge for healthcare in the 21st century. The reason government is so important when we think about health systems is because they really offer the stewardship. It really starts there often at the national level more than the international level. Although the international can have all sorts of impacts on national policy and guidance. But at the national level, it's really the government that provides that governance and stewardship of how health policies are implemented, what health policies go forward. And that's very defining in terms of how then national health systems respond. A very good example is here in the UK, where you have the National Health Service. The real government focus is really on providing access and care free at point of delivery to all citizens within the UK. And that is quite an endeavor. And that is something that was a policy decision that was taken and is now fulfilled in its various forms through the health system. So health policy really shapes the kind of narrative in which organizations that work in this kind of broader health ecosystem operate. There's also, of course, the regulations and the other aspects of kind of regulating and overseeing health, which is very important, much more important probably than other sectors because of the nature of the service that's being delivered. Financing is also a very important part of health systems. And actually, I would argue that it probably gets too much time and focus. But it's because often when we're thinking about health system, and particularly thinking about those who can least afford to pay for health care, they often will look to the government to provide some sort of basic health or health services. We also know that in a number of low-income countries particularly, but also in some high-income countries, families can be completely altered, devastated by long-term illness or health care because of out-of-pocket expenses. So finding ways in which we can deliver good, high-quality health services, but also create those services in which people can access them regardless of their income, without necessarily having catastrophic circumstances, impact them from not being able to either finance the health care they need or because they are left indebted due to illness. This becomes a very important part of thinking about our health systems. So much of the health kind of service research that's been undertaken is often in this area of looking at costs, looking at how much it costs to provide a service, what is the most cost-efficient way to provide that service or that care, whether it's therapeutics or even preventative care comes with a cost. So this will continue to be a very important aspect of how we think about health systems. But I'd also challenge that paradigm and say that we also need to start thinking more and more about health and healthcare as an investment in our citizens, much like we do with education, and think about the kind of positive externalities, the benefit that we get from having people who are more productive, who can have healthier lives, looking at our aging populations as an opportunity to extend people's ability to be productive and be a part of society. And again, if you look at areas in which people have low incomes, they often have poor health, they often are unable to work, and this again affects the overall society. So we need to also understand that aspect. And then last but not least, we need to understand kind of the value of what we're getting. We have often looked at healthcare as a pay-for-service, and we need to think about it in a much different way. We need to think about it more about what are the outcomes of healthcare rather than just the costs. Another area of healthcare systems, of course, is the workforce. The workforce is incredibly important. And we know that there is really been an underinvestment in developing and training our clinical professionals. Most countries have taken an approach where they've really undercut. They've gone on the low side, worried about creating an oversupply of health professionals. So this has led to all sorts of what I'd call perverse behavior, where particularly low-income countries often are at risk of losing their health professionals to higher-income countries through migration and immigration to work in other places and locations. So we need really to tackle this problem of the kind of global healthcare workforce. And it's also by looking at other ways in which we can support our workforces. There's lots of discussion about burnout and people who are overworked and undercompensated. So again, as a society, we need to appreciate our kind of investment that we want to make in healthcare. And machinery and equipment and hospitals are only as good as the people that work in them. So we need to really think about how we train health professionals, the different pathways. We need to focus not so much on job roles, but on tasks, what people do. How can we kind of unbundle our previous thinking around our workforce and workforce roles to make a better, more agile group of people that can work together to find solutions and to treatments for healthcare. This is a huge issue because as we move forward, we know that we've got the demand will outstrip the supply. The supply is already very below what it needs to be worldwide. And certain countries are much more vulnerable. Many countries in low-income countries face critical shortages, particularly of specialists in certain areas. But the other thing is, we know that we're going to need lots more general practitioners. As I pointed out before, as we look to manage long-term care and aging populations, that general practitioner will become so important. And yet we have incentivized a system that's really focused on specialization. So again, how do we transition our workforce? How do we make sure that we're training up enough people, training them up with the right skills, not necessarily into current roles, so that we can now move them into a different kind of healthcare and a delivery. And that's really whether it's through prevention, diagnostics, or therapeutics, we need to think differently about how we deploy our workforce, particularly if we're going to deploy them along digital health and innovation and what that can look like in the future. Another important part of a healthcare system is information. We hear a lot today about data and the need to collect information. But how do we really raise the kind of accountability? How do we use that information? How do we make sure that we safeguard people's personal information? And also, how do we use that information? And these are really going to be continuing important questions for health systems. We talk a lot about remote monitoring devices, and we have apps that are collecting information. Some of those sit in the private sector as well as in the public sector. So how do we make sure that the information that's being collected is accurate, used appropriately? These are all very important questions. And people are much more willing today than ever before to give their data, give their information. But we need to make sure that we're not collecting information for the sake of that. It's also how do we make sure within our health organizations that the resources are being deployed correctly, that the pathways and that we create for healthcare are really delivering what we need. And also, how do we identify the bottlenecks? And all of this will be very important through using data and data information. We should be able to become much more efficient. We should be able to understand, how our health systems need to be structured. But we also need to realize that in some countries, they don't have the same access or capabilities to collect information, to process that information. So how will we share across countries? How will we create and improve kind of accessibility and data literacy, and also, the kind of processing equipment that will be needed to really make a difference. These are all very important challenges that make up an integral part of health systems. Knowledge is also a very important part of our health systems. How we collect information is not just to see the numbers, but how we analyze it. How do we build knowledge into our organizations? How do we create learning organizations? We often in business will talk about being a learning organization, but what does that really mean? One of the things that we see in healthcare historically is this idea that it's very regulated, processes put in place, steps to be taken, and really a very low tolerance for allowing people to experiment and try new things, and partly because we're dealing with other human beings and their well-being. But as we go forward, we need to start to think about how can we use knowledge? How can we allow ourselves to be a learning organization? How can we get people to be transparent about what they need to share or what they need to learn when knowledge isn't acquired? And this is going to be very important, that kind of learning and training. We often think about kind of pre-qualification degrees. The kind of education that goes into a clinician can be very important, and getting them certified and making sure that they're qualified. But how do we ensure that that lifelong learning is in place? And it's not just for clinical staff, it's for non-clinical staff as well. And this is a very important part of creating innovation. People who are learning, people who are able to bring ideas forward, who are constantly refreshing what they know. And this is something that we need to build into our health systems and is an integral part, particularly in the world that we live in today, where things move at a very fast pace and knowledge is so important. Drugs and technology are also very important to health systems. As we've seen with the COVID-19 pandemic, the ability to produce vaccines and to be agile and move forward with drugs and the technology and the enabling environment around them is so important to our health systems. We've also come to realize that there's a convergence between biotechnology and pharmaceuticals. And this is really important in terms of being able to develop treatments, therapies, drugs, medical devices, and to really move forward in a quick and agile way to help different people within our populations and to treat some of the diseases that for a long time we've felt that were not treatable. But one of the things that we also saw during the pandemic is the kind of, what I'd say, the ugly face of, nationalism rear itself up in terms of the distribution of the vaccine, the way where countries produce, those countries that put more into research and innovation. And so, again, I think it beholds a place for governance and how governments work together and how we see this healthcare space and how the private and public partnerships are so integral for really delivering good healthcare for our populations. Research is also really important when we're talking about healthcare and health systems. We have only just done a fraction of the work that needs to be done. There are so many unanswered questions. And of course, as we evolve as a species and climate change is impacting us, environmental issues, we need more research. We need to understand all the kind of different complex systems that exist within our healthcare systems. So it's really vital that we make sure that we're not only undertaking research in terms of thinking about health science, but also in terms of the culture and organizational structures and the impact that those changes that we make as we go along are having, so that we can be an evidence-based approach to how we look and think about our health systems. So our service delivery will always be very important to our health system. As we think about health systems delivering better health, that is through the services that we offer. And so that area of health service research, looking at the data, understanding how our operations take place, how do we create pathways, how do we get supplies to people in need, all of these things will continue to be very important, as well as thinking about the structure in which we offer our services. How will hospitals evolve? How will they become more efficient? Will they become smaller? Will we have more clinical, more mobile health? How will population health factor into this? How will we think about our communities and what we put there and which services for which communities, and how will data play a role in that? So the service delivery is really a key aspect of everything we do in terms of thinking about our health systems, because you can't have a good health system without good service delivery. We hear much today about the need for better equity, particularly when we're talking about health, because health should really be a human right. Everyone should be able to have good health. But in spite of lots of talk and discussions about health and social inequalities of health, unfortunately, we see many countries moving in the wrong direction. Actually, more people being pushed into poverty, unfortunately, for reasons beyond their control. And so we do have to really raise the bar in terms of how we think and address inequality, social determinants of health within our health system, so that we can create better health through better societies and economies.